Yeah.
I'm curious, like, as the oncologist, what does that look like for you when patients come and they want something that is above standard of care? Are there some situations where you're like, I know standard of care needs to be updated, and so you're totally in line, or are there pushbacks?
Yeah, there is a delay when a new trial comes out and the results are pretty clear that this is better than what the guidelines wrote. And guidelines, for those who don't know, tend to be a group of oncologists, experts in the field that come together and say, here's every situation we could think about. What should you do? But it requires looking back at data that already happened. So if the trial came out last month and the guideline committee meets, twice a year, the guidelines are going to be outdated. And even then, people on those committees may disagree about what one should do because data is complicated. There's a lot of it out there, and it's not as crystal clear as one may think. So there are situations where the guidelines are outdated, or you as a provider work in a nuanced field and you don't necessarily agree with them. I mean, they're called guidelines. So they are meant to guide treatment, but they don't necessarily dictate treatment. And every patient's unique. So guidelines may not always apply. There may be certain toxicities that are not acceptable for a certain patient. Maybe usually you do surgery in this circumstance, but they're not going to tolerate surgery very well and you don't want to damage them. So you'll do something different. We hope you liked this video. To support cancer research and get clear expert answers about cancer, follow us and visit krakencancer.org to join the Kraken Cancer community.